Brazil now has the third highest number of reported coronavirus cases in the world. The World Health Organization has registered the highest number of new coronavirus cases worldwide in a single day since the outbreak of the pandemic. The UN Security Council debated the situation in Palestine this Wednesday in the face of the Israeli regime's plans to annex parts of the West Bank. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Brazil now has the world's third highest number of coronavirus cases. As President Jair Bolsonaro continues to fail to act, state governors are moving forwards with their own measures. Our correspondent Brian Meir brings us the details.
Last night, the Brazilian Federal Health Ministry announced that the number of confirmed coronavirus cases in Brazil had climbed to 257,000. In terms of absolute numbers, this now puts Brazil ranked at number 3 in the world. And with the death count rising by over 1,000 for the first time since the pandemic began in one 24-hour period, at 17,000 now, Brazil is ranked 6th in the world in terms of deaths from coronavirus. This discrepancy between confirmed cases and deaths implies that there's a lower mortality rate here. And one of the reasons for that might be that they've started rolling out the use of anticoagulants in the São Paulo municipal public health system after scientists at USP University discovered that some of the patients who were dying in intensive care were dying because of blood clots forming in the microveins of their lungs. Brazil has just lost 2 national health ministers in less than a month, both of them resigning out of arguments with far-right President Bolsonaro. He continues to insist that the solution for the pandemic is to send everybody back to work and just give out free hydrochloroquine at the local public health clinics. Meanwhile, luckily for the citizens of Brazil, the governors keep ignoring Bolsonaro's orders. Lockdown is intensifying in São Paulo, which is home to 20% of Brazil's population and also the epicenter for virus transmission. There's nothing that the president is doing that is helping, but luckily we have governors and mayors in different states across Brazil that are not paying any attention to him.
Bolivia's Health Minister Marcelo Navajas has been arrested following a corruption scandal involving the purchase of medical ventilators at an inflated price. Navajas is the owner of an elite private clinic and was appointed as minister on April 8th by de facto President Janine Áñez. 2 consultants from the Inter-American Development Bank have also been arrested after the bank released a statement supporting the deal. The Washington-based bank is known for extending credit on the condition of imposing neoliberal reforms. Chile has seen the highest daily figure for new coronavirus cases since the health crisis began. Chilean Undersecretary of Public Health Paula Daza on Wednesday offered a daily report on the epidemic in the country, announcing more than 4,000 new COVID-19 cases and 35 deaths. This brings the total number of cases to over 53,000, while the death toll has reached 544. Meanwhile, Health Minister Jaime Mañalich reported that the new category of probable cases was established to identify and control possible infections. The minister explained that the new category is different from suspected cases, as these are people with symptoms but whose PCR test results were indeterminate. In 56 days of lockdown in Argentina, 49 femicides were reported. 71% of the crimes were committed in the victim's home. From Buenos Aires, Carolina Silvestre brings us details on the measures adopted by the Alberto Fernández administration to address the gender-based violence in the country.
Through resolution by Minister Elizabeth Gómez Alcorta, the 144 hotline became a critical service within the framework of the health emergency.
Different communication channels were included. In addition to phone calls to 144, an email address and a WhatsApp line were made available. An administrative resolution was also issued clarifying that people in situations of gender-based violence can go out and request any type of assistance with their children without needing any type of authorization. And we also work hard with federal councils and municipalities to ensure that the response is guaranteed.
Comprehensive policies are the tools chosen by the Ministry of Women, Gender and Diversity to address violence during the quarantine, and the key to this is the presence of the state.
We understand that a present state is a state that has to transform the reality of the people, and for that it has to think about public policies that promote them. On the one hand, they must reduce the equality gap, but on the other hand, they must have all the necessary mechanisms to ensure that the approach is comprehensive.
Comprehensive policies implemented by the ministry that transcend the pandemic.
It means access to housing, access to land, access to employment and job training, access to health, access to care facilities to develop an empowered life project, without a doubt. This is the greatest challenge that lies ahead of us.
Officials confirmed that the situation of gender-based violence in inter-family relations have intensified during social isolation.
Another of our main objectives was to ensure that protection measures ordered by the justice system were beyond situations of isolation, and to ensure that people who are in a context to gender-based violence in the face of an emergency situation can access existing homes and shelters in the provinces and municipalities, and in those places where their capacity was completely exceeded or where they did not have these mechanisms in place, and be able to sign agreements with union hotels.
The reference of Mulama Carolina Paez raises the need to carry out massive communication campaigns and increase assistance.
To expand fund allocations for women in situations of gender-based violence and or vulnerability, speed up implementations in the framework of the health emergency, economic allowance for relatives of victims of femicide, free assistance and accompaniment and legal advice.
Asesoramiento jurídico gratuito.
Gender and diversity measures taken by the national government also include food assistance and other social programs for LGBT and persons with non-binary identities.
Y otros programas sociales. Carolina Silvestre, Telesur, Buenos Aires.
Venezuela reported 75 new COVID-19 cases on Wednesday, 3 of which were locally transmitted, while 67 were imported cases from Brazil and Colombia. Venezuelan President Nicolas Maduro explained that all confirmed and suspected cases are being monitored by the health authorities.
Look at the 67 foreign imported cases of Venezuelans who arrived from Colombia or Brazil, and they were tested as soon as they crossed the line. They crossed the border. All of these cases are under epidemiological and medical control at the border, and they're staying there for 14 days. It would be much worse if they contaminated the country, if they entered and contaminated the whole of Venezuela.
An extraordinary meeting of the United Nations Security Council took place virtually this Wednesday to discuss the mercenary incursion into Venezuela on May 3rd. The meeting was convened by the Russian Federation. Venezuelan ambassador to the UN, Samuel Moncada, thanked Russia for its support to denounce the events before the Security Council. He reiterated the complaint that the governments of the United States and Colombia facilitated the planning, training and financing of mercenaries with the objective of entering Venezuela to perpetrate indiscriminate killings of innocent civilians, as well as selected killings of high-level government officials and the assassination of President Nicolas Maduro. Despite the extensive evidence presented by Venezuelan authorities, the governments of the US and Colombia continue to refuse to cooperate to establish the facts and avoid impunity. The Venezuelan government has made more than 30 arrests of mercenaries involved in the events and revealed a contract that links opposition lawmaker Juan Guaido to the organisation of the operation. And representatives of several UN member states, including Russia, St. Vincent and the Grenadines and China, voiced their condemnation of the attacks on Venezuela and reiterated support for dialogue and non-interference.
I want to indicate from the outset that the situation we are facing today is unfolding around Venezuela, not inside the country. The recent incidents of breach of Venezuela's sovereignty by foreign agents pose a direct threat to the country's peace, as well as to regional security and stability. We would like to question what role neighboring Colombia had in this story. It's hard to imagine that this clandestine operation that originated on its soul was conducted without any knowledge about it. US authorities claim that they have nothing to do with this. We would be glad to believe them, but fail to explain that according to the contract, 2 American citizens were planning to take hostage of legitimate Venezuelan president and bring him to the US. For what purpose?
China took note of the letter by Venezuela PR to the Security Council. Recent attempt against Venezuela threatens regional peace and security. It deserves great attention of the Council. China strongly condemns aggression into Venezuela territory and violation of its sovereignty. Any acts that target foreign leaders, threaten their people, or attempt regime change are a grave violation of the international law.
The recent attempted armed incursion into the Bolivarian Republic of Venezuela is only the latest in a long series of unwarranted aggressions meted out against this sovereign nation over the past 2 decades. We maintain that the internal political dispute within the country does not constitute a threat to international peace and security. More pointedly, the situation in Venezuela does not threaten the national security, territorial integrity, or political independence of any external state party. And all acts of aggression, including unilateral economic coercion, carried out under these guises are unjustifiable and illegal.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. The World Health Organization has registered the highest number of new coronavirus cases worldwide in a single day since the outbreak of the pandemic. The WHO registered 106,000 positive cases worldwide in the last 24 hours. The total number of positive cases reported worldwide has now surpassed 5 million, while COVID-19 has claimed more than 320,000 lives in more than 150 countries. WHO Director General Tedros Adhanom Ghebreyesus expressed concern about the spread of the virus in countries with vulnerable health systems and called on the international community to evaluate responses to mitigate the impact of the pandemic.
Still have a long way to go in this pandemic. In the last 24 hours, there have been 106,000 cases reported to WHO, the most in a single day since the outbreak began. Almost 2/3 of these cases were reported in just 4 countries.
All 50 states of the US have now begun to reopen their economies to some extent, despite the ongoing health crisis. The state of Connecticut was the last to begin allowing some businesses to operate from Wednesday. However, there remain vast differences in how each state is deciding to lift measures, with some advancing much faster than others. On April 7th, 42 of the 50 states of the US had issued stay-at-home orders with the aim of containing the spread of the virus that has caused almost 94,000 deaths. However, since late April, several areas began to lift some of the restrictions put in place at the state level as the Donald Trump government let the federal guidelines expire. A report has revealed that the privatisation and outsourcing of the United Kingdom's National Health Service has further aggravated the crisis sparked by the coronavirus outbreak. A report by the anti-privatisation campaign group We Own It and the Public Services International Research Unit at the University of Greenwich noted that the part privatisation of the National Health Service supply chain has resulted in a dysfunctional process that has hindered the supply of essential personal protective equipment for hospitals and health workers. More than 11 private suppliers provide medical equipment to hospitals, with several layers of outsourcing, meaning there's a lack of public control, while the model creates the risk that sufficient supplies are not available to manage unforeseen events such as the coronavirus pandemic. The UK has reported more than 248,000 coronavirus cases and more than 35,000 deaths. Spanish health authorities announced the use of face masks will now be obligatory beyond public transport. According to the order approved by the Ministry of Health, starting this Wednesday, all people over the age of 6 must wear a mask in public or enclosed spaces if the minimum 2-metre distance between people cannot be followed. Only people who have breathing difficulties that might be aggravated by the use of a mask or those with certain medical conditions or disabilities are exempt. The daily COVID-19 death toll has dropped to under 100 for the past few days in Spain, while more than 54,000 cases remain active. Russia reported its lowest daily increase in coronavirus cases to date this Wednesday at less than 9,000. Russian authorities have said they're entering a phase of stabilization, but called for precaution before lifting all restrictions. Despite reporting more than 308,000 coronavirus cases, the COVID-19 death toll is less than 3,000, which experts have put down to widespread testing.
As of today, 17 regions have reached criteria for step-by-step removal of restrictions. 14 of them have already reached adequate decisions and lifted restrictions as part of the first stage. As we have discussed, it should be done very carefully so that we don't ruin the delicate balance that took so much effort to reach.
And we're taking one final break now, but stay with us for more. Welcome back to From the South. The UN Security Council debated the situation in Palestine this Wednesday in the face of the Israeli regime's plans to annex parts of the West Bank. The UN's Middle East peace envoy, Nikolay Mykhalenov, issued a stern warning against any unilateral action that could undermine diplomatic efforts to get Israelis and Palestinians back to the negotiating table. Meanwhile, Palestinian ambassador to the UN, Riyad Mansour, urged the UN Secretary-General to hold a dialogue with Israel to call on its government to halt its plans to annex parts of the West Bank. The ambassador noted that Palestine is making contacts at the international level to form a broad and strong front to prevent Israel from implementing its plans. And the UN Security Council meeting took place after Palestinian President Mahmoud Abbas declared an end to all agreements and understandings with Israel and the United States on Tuesday, stressing that Israeli annexation plans would ruin any chances for peace. The Palestinian leader also stressed that the United States, as the primary ally of the Israeli occupation government, is fully responsible for the oppression of the Palestinian people. More than 2,500 people have been killed by COVID-19 across Africa, according to a recent UN report. UN Secretary-General Antonio Guterres expressed on Wednesday his total solidarity with the people and governments of Africa tackling COVID-19 and warned that millions of people in the continent could be pushed into extreme poverty due to the pandemic. South Africa has reported the highest number of cases in the continent at more than 17,000, while Egypt has recorded over 13,500 cases. On Monday, the Seychelles became the third African nation after Mauritius and Eritrea to announce that it was virus-free, following the recovery of all 11 cases identified.
But the pandemic threatens African progress. It will aggravate long-standing inequalities and heighten hunger, malnutrition, and vulnerability to disease. Already, demand for Africa's commodities, tourism, and remittances are declining. The opening of the trade zone has been pushed back, and millions could be pushed into extreme poverty.
The South African Health Minister refuted criticism of the country's COVID-19 lockdown on Tuesday, stressing that the measure has effectively stalled the spread of the novel coronavirus. Sweli Mkhize stated that with the implementation of the lockdown, South Africa's healthcare sector won time to prepare for the rising wave of infections and deaths. The official responded to rising criticism from the opposition regarding the strictness of the measures, which they claimed were not based on scientific principles. The minister noted that the criticism comes at a time when the Western Cape province accounts for 60% of national cases, with the numbers increasing rapidly on a daily basis as compared to the rest of the country. South Africa has reported a relatively low death rate compared to the number of cases identified, which experts have noted is due to widespread testing. Kenya has now reported over 1,000 confirmed coronavirus cases after it recorded 66 new infections on Wednesday. The number of new positive cases is the highest yet since the outbreak was first announced in the country in mid-March. According to Health Minister Mutahi Kagwe, 64 of the new cases are Kenyans, while 2 are foreigners. The minister also stressed that border points continue to pose a high risk of transmission of the virus, with the majority of victims being cargo truck drivers. Kenya has reported 50 COVID-19 fatalities. Polls opened in Burundi on Wednesday, with the Electoral Commission calling for a peaceful vote, despite simmering political violence and the risk posed by the novel coronavirus pandemic. The election marks the end of the mandate of President Pierre Nkurunziza, the country's leader since 2005, who's not running for re-election. Unlike Ethiopia, which postponed its August elections due to the epidemic, Burundi's government has chosen to push ahead. The country of 11 million people has reported just 42 coronavirus cases and 1 death. Last week, the government expelled the national head of the World Health Organization following public criticism that all parties were holding mass rallies despite the risks. Cyclone Amphan has hit the coast of India and Bangladesh as authorities rush to evacuate residents. On Wednesday, the powerful storm struck West Bengal in India and Bangladesh with winds of more than 100 kilometers per hour. There are already reports of extensive damage from authorities of both countries, while evacuations have been made more difficult due to the coronavirus pandemic. The cyclone is considered the most powerful to hit the area in the past 2 decades.
Many people have gone to the cyclone shelters fearing the rise of water level. The authorities have already arranged dry food for them, and their meals are being cooked at every Union Council office. But there is a shortage of drinking water. There are sanitation facilities for them, but no social distance is maintained there. For that reason, the fear of coronavirus spread is persistent there.
And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.